Hi there, this is Dr. Evan Osar with Discover IMI. Welcome to this edition of Integrative Movement Insider. We're about to start the weekend at DCAC Fitness Conference. Janice and I are out in Reston, Virginia, about to share several sessions today and then 2 more sessions tomorrow. My first session today. Well, first, let me back up. Thank you for being here today. Hope you're having a great week. Hope you had a great week and you're getting ready to empower your clients today and head off to the weekend. Thank you for being part of our community and allowing us to share this information with you. So, as I mentioned, today Janice and I are at DCAC Fitness Conference. My first session at 12:30 is about the no stretch solution to tight hip flexors. And if you work with older clients, you know lots of your older clients, maybe even yourself, you present or you have or experience chronic hip tightness. Now, one of the things we discussed last week in our 3-part series on 2 Anatomy Geeks. Hello, Mary Trilla, how are you? Good morning, good to see you. Hope you're doing well. One thing we discussed in 2 Anatomy Geeks last weekend around the idea or the topic of knee osteoarthritis is a lot of our clients, especially our older clients, older being relative. Stephen Head, I appreciate you, buddy. You're like, older's relative. I'm like, yeah, because you're in awesome shape, and I think you're my age, and here in our nearing our mid 50s. So one of the things that happens to our older clients, relatively speaking, is they go into posterior pelvic tilt. Now, what that does is it does something to your hip flexors. So put your hands on your hip flexors. So just put your hands on the front of your thighs, right in front of your hips, go into posterior pelvic tilt. Many of us are already there, depending on your age and what you do for a living, depending on your medical history. Most of us are probably in some level of posterior pelvic tilt, not anterior pelvic tilt. So if you put your hands on your quads and you just go into a little bit more posterior pelvic tilt, you'll feel that your quads actually tighten. Your hip flexors actually tighten, like your tensor fascia lata, rectus femoris, sartorius, your 3 primary hip flexors. So what happens is, it's not that they're shortening and tightening, they're actually getting longer, like a rubber band, you're stretching them out, so they're getting more taut. So you're tensing those muscles, you're tensing also the anterior fascia, the fascia that encases the front side of the thigh. Well, I also want you to now relax yourself, relax your thighs. Make sure your quads are relaxed. So just put your hands down here. Sorry, I'm in a tight space here, so I can't really angle the camera down, but just kind of make sure your quads are nice and soft and relaxed now. Your hip flexors are nice and soft and relaxed, so you're in a slight anterior pelvic tilt. Now reach down and feel your kneecap when your quads are actually relaxed. Your kneecap should be floating on the front side of your knee. Okay, so when your quads are relaxed, your hip flexors are relatively relaxed, your patella basically floats on the front side of your trochanters, or I should say the epicondyles, not the trochanters, get your anatomy right, the epicondyles of your femur. So there's grooves underneath your patella, and they glide right on the front side of the epicondyles of the femur. Now what I want you to do is go back into that posterior pelvic rotation, that posterior pelvic tilt. Now your quads are tight again, your hip flexors are tight because they're overstretched like a rubber band, right? Now go down and feel your kneecap. Well, now your kneecap is pulled taut up against those condyles, those epicondyles of your femur. Now think about your older clients. That's how they're living their life. That's how they're sitting. That's how they're walking. That's how they're squatting, unless you and I change their strategy, help them adopt a more optimal strategy. So what's happening is the patella, that kneecap, is being pulled taut up against the condyles. Well, it's a synovial joint. Your synovial joint needs optimal gliding of the patella. It needs optimal fluid motion. The tauter those quads are, the tauter the hip, more taut the hip flexors are, and those quads are, the more tight and restricted that patella is up against the condyles. Well, that starts to wear away not only the cartilage on the femur, but the cartilage underneath the patella. Very common cause of knee pain, very common cause of patellofemoral pain syndrome, so PFP, patellofemoral pain syndrome, so pain around the kneecap, especially with squatting, bending, going downstairs. So one of the things we want to teach our client, one of the things I'm going to teach the class today on the no stretch solution to hip flexors, is we need to teach our clients to soften their quads and get into, not to force an anterior pelvic tilt, but stop forcing and staying so locked into a posterior pelvic tilt. And again, you just have to think about why or what happens to our clients as we get older. As we get older, as our clients get older. Well, we're developing spinal stenosis. All of us are developing at a certain level, some of us faster than others, some of us more extreme than others. Well, spinal stenosis, or narrowing of the spinal canal, puts the pelvis into a posterior pelvic tilt because it creates more space by going posterior pelvic tilt, flattens and flexes the lumbar spine. That's also the position because of chronic sitting. Most of our older clients have sat most of their lives. Most of us, if we're fitness professionals, we're on our feet a little bit more. Health professionals, we're on our feet a little bit more. But most of our clients that come to us, they sit for a living. They're not out there working manual, labor type jobs. So again, they're moving into posterior pelvic rotation. That's tightening their quads, like that overstretch we talked about. That's flattening, or I should say, pulling that kneecap tight into the condyles of the femur. It's causing them to stay sort of pushing the hip forward so their quads or hip flexors stay tight. So one of the most important strategies we can teach our clients to address chronic tightness as well as chronic knee issues is to relax out of so much of that gripping, that posterior hip gripping. We may have to do some myofascial release, but we also need to train, we also need to train a more optimal hip hinge or anterior pelvic rotated position. So I hope that made sense. Get your clients to stop gripping their posterior hips so much, get them to relax their posterior hip, get them to create or give them the ability through your myofascial release work. Hey, Michael McAlee is one of our integrative movement specialists. Thanks for being on here. Hello, my friend Rahul. Good to see you as well. So we want to do myofascial release, maybe some, self myofascial release, some lengthening of the posterior chain, glutes, hamstring, external hip rotators to allow more optimal anterior pelvic rotation, and then train them to do hip hinge so they can use their hip more appropriately, take the stress off their knees, and you can help so many clients. And even if your clients need knee surgery, so whether they need arthroscopic surgery and or replacements, you can help them get ready for the surgery. And more importantly, or I should say as importantly, you can help them prepare and return to function, and probably more optimal function after their joint surgery and or joint replacement. And that's how you become the go-to specialist for your current clients and help more individuals that need, wants, and will pay you for your expertise. So I hope that made sense. I hope that you are empowered to go out there and continue to share this good message with your clients that you are in the best position. I was just talking to a manager of a health club. They have 22 trainers and they do like $200,000 to $300,000 a month in revenue. And one of the things I was sharing with her is, she's like, why do you think personal trainers and fitness is so important for clients? And I'm like, because you see clients more than anybody. You see clients more than medical doctors. You see clients more than chiropractors, physical therapists. You are on front line or in the front line or on the front line as to healthcare and your clients' well-being. So nobody else is teaching your clients this information. So go out there and educate, empower your clients, enroll more individuals. So because there's so many people that need what you have. So if you're looking for more information, check out Two Anatomy Geeks. We just finished a 3-part series on hip and knee osteoarthritis. We talked about surgery, labral surgeries. We talked about cartilage degeneration. We talked about joint replacements. And more importantly, we shared, Jill and I, my fellow anatomy geek, shared strategies for improving, assessing and then using corrective exercise to create a more optimal strategy. Hey, Tyler, I'll see you today. Actually, we'll see you later today. So can't wait to meet up with you here in Reston, Virginia. And for the rest of you, check it out. Two Anatomy Geeks is really a fun time. It's a great community, a very supportive community of like-minded individuals who are just there to help support each other, help empower and educate ourselves. And I get educated every single time. Like I learn every single day or every single session with Jill, because she's an amazing anatomy instructor. And then again, like I said, it's very important that we help you apply this information. So we give you lots of strategies to use with your clients. And it's just a great time. It's a great opportunity to learn, get CECs, and advance your own skill set, knowledge, and more importantly, be able to use this information and apply this information and educate your clients. So look forward to seeing you there. And if we see you, if you're at Reston, Virginia, at the DC AC Fitness Conference, stop by, say hello. We look forward to seeing you. Everybody else, have a great weekend, and we look forward to seeing you next time at Discover IMI. This is Dr. Evan Osar. Go out there and lead your communities. Take care.